I'm Erica Giblin. I'm a breast surgeon here at St. Vincent Carmel Hospital. I'm here to talk about breast health and breast cancer.
I'm Dr. Kristin Govert. I'm also one of the breast surgeons here at Ascension St. Vincent. And yeah, here to talk about breast health, breast cancer, breast awareness.
I'm Victoria Vivians. I'm a guard for the Indiana Fever.
I'm Tiffany Mitchell, and I'm also a guard for the Indiana Fever.
One of the things that women always come in to see me when they have a new diagnosis of breast cancer is they're always shocked that they have a diagnosis because they didn't feel anything. Like they were fine, they were doing their thing, they went to get a mammogram and boom, they got a biopsy and then they were diagnosed with cancer. So what I try to tell women is that mammogram actually saved their life because they had no idea that that cancer was developing inside of them. And that's the whole goal of the mammogram, is you want to get a picture before you even know that you have the cancer, because that tends to mean that it's early, we can treat it, and you have cure. We don't want to have people not get mammograms. A lot of people are super busy. They don't have time for it. They're busy with their kids, their jobs, or whatever. So they'll forget to get their mammogram. 2 years, 3 years, becomes 5 years, becomes a ball that just keeps rolling. And then they present with a mass. So for most women, they don't really feel a breast cancer until it's about that big. They don't notice that, okay? They're not going to feel something this big, okay? So therefore, they're usually later stage if we find them when they didn't have a mammogram. And that's unfortunate because then survival is lower. And the whole name of the game here is we don't want anybody to die of breast cancer. So that's why we just stress to people that it's super important to go get a mammogram even when you're feeling fine, you don't think anything's wrong, because that mammogram may save your life because it's going to detect your breast cancer before you even knew that it was there. That's one of the most important things I want people to know. Because a lot of women say, you know, I know my body. I'm going to know when I get a cancer. No, you're probably not. Not until it's big and it's at an increased stage. We don't even want it to get to that point. The other thing that I'll see is a lot of women will come in and they'll say, when they have a cancer, I knew I was going to get cancer. And I'm like, how do you know you were going to get cancer? And they'll say, my mom had breast cancer, my sister had breast cancer, my grandmother had breast cancer, my other sister had breast cancer. And that makes me sad because the odds that they actually carry a gene, like they were born with a cancer gene, is high. And a lot of people don't know there are things we can do to prevent them from ever getting that cancer. So if they have a strong family history, we would want to see them because we can do a little spit test or a blood test to see if they carry a cancer gene. And if they do, we can start number one, doing imaging early so we can catch the cancer small. Number two, there's stuff we can actually do and give them to help prevent them from ever getting a cancer so that they don't have to follow in their mom's footsteps or their sister's footsteps. So I hope a lot of people learn today that if they do have a strong family history, call your doctor. You know, there's stuff that we can do to help them from ever even getting a cancer, particularly breast cancer. So.
On the other hand, I think that a lot of women assume that if they don't have a family history, that they're not going to get breast cancer. And I think a lot of people are surprised to know that 3 out of 4 women who were diagnosed with breast cancer never had a family history, didn't have anybody in the family who had breast cancer. And so that's why they really are so surprised when they're diagnosed. But again, if we can get a mammogram done once a year, starting at age 40, then it's really important to get that screening examination done. Let's just check and make sure that there's nothing that we can catch early and treat early. Because as Dr. Giblin said, the earlier we treat, the better our outcomes are.
The other thing too is if a person feels a lump, we'd rather see them sooner and just try to figure out is the lump a cyst, is it a water-filled sac, or is it something. Some women will sort of put their head in the sand, you know what I mean, and that lump starts to get bigger and bigger and bigger until it gets to the point where they can't ignore it. We would rather see somebody sooner and just try to figure out, is that lump something we have to deal with or not, you know, instead of trying to sort of hide it and push it away, because you can't do that, you know. It just really helps to know beforehand.
So how's the treatments changed over time to decrease the amount of people that have died from breast cancer?
They've changed tremendously. Breast cancer is one of the cancers where there's been a ton of research on it, so it's come a long ways. We now have antibodies that can attack different breast cancers. We now have these targeted, what we call precision medicine things that are medicines that can go actually like heat-seeking missiles to kill the breast cancer. We didn't have that stuff 20 years ago. So I tell patients when they come to see me, they'll be like, you know, oh, can you cut my cancer out? I'm like, that's part of it. We're cutting out what we see, which is important. But what's even more important nowadays is the medicine they give, because it's so specific. It goes precisely after their breast cancer to help kill it. And that's the name of the game. We want to kill all the cancer.
Mm-hmm.
We don't want the cure. We don't want anything coming back anywhere.
Right.
So it's really come a long ways that way.
Okay. I know you said age 40, but so say for instance you feel like, okay, I'm 27 and I want to go in just to get a check just because, is that like safe to do? Like can any age go before the mammogram? Like, cause
yeah, well, I would say number one, if you want to get things checked out and you're worried for whatever reason, you either feel something or family history, we would first recommend you come see a breast surgeon. Well, part of what we do is not just surgery. We do exams, we take a look at the tissue, we make sure everything is looking okay. So we're trying to figure out what is your lifetime risk of getting breast cancer? Is it average? Is it above average? If so, how much? Based on that, we can then recommend, should you, even at 27, be getting an MRI every year? Do we need to start a mammogram at age 30? Do we got to go 10 years earlier than 40? So it is worthwhile, I think, coming in to get evaluated if you know.
Yeah, like so imaging is like, you can just do that just to be safe, even if you don't have a history of breast cancer or in your family.
So what I would recommend is not to start with imaging if you just want to be safe.
Yeah.
You first should see a provider. Have us do a clinical exam on you, okay? And then we may ask certain questions that you may not even think that are relevant to your risk. They may actually be risk markers. And then that can help determine your own individual imaging plan if that is what we should be doing, okay? Yeah, it's individualized to each person and their own issues or whatever, or maybe non-issues going on, okay?
And I know some people don't know this, but like say for instance you want to self-check. Like can you tell us how to self-check?
Absolutely. Number one, you want to make sure you self-check not the week before your period. Your breast's going to be all swollen, it's going to be lumpy, it's going to be bumpy, and you're going to be like, I feel 50 million lumps, okay? That is not the time to do it. You want to do it about a week or a week and a half after your period. That's when your hormones are lower, so things are calmed down. The way you want to check is sitting up first, and you first feel superficially all over the place, even in the armpit. Then you lie down, okay? And you feel, and you can do circles or you can do lines. Either way, doesn't matter. You just want to cover all of the breast tissue and the armpit, okay? That's what you would want to do.
And you feel for lumps.
You are. And you're not feeling for, you feel for any lumps, but cancer is usually very specific. It usually feels like a rock hard pee. I mean, rock hard. Okay, usually the softer stuff, the softer lumps usually are benign, okay? That being said, if you feel any lump, you get in to see the provider. We do an exam, ultrasound, and all that, okay? Yeah.
I always tell people to remember that the breast is lumpy, bumpy. That's kind of normal breast tissue. You're feeling for the thing that feels different than all of the rest of the breast tissue. But if you feel something at all, we're always happy to see you. So come on in, get it evaluated, let us check us out, and make sure that there's nothing that we need to evaluate further.
The final thing I would say, which is actually super important, and you guys are basically embodying it, is good exercise and nutrition. One thing that we are really finding out is we are having younger people diagnosed with breast cancer and more people. A lot of it's based on nutrition. So studies have shown people who maintain good body weight, good muscle tone, eat good nutrition, not a lot of sugar, they actually have a lower incidence of getting any cancer, including breast cancer. That is becoming something very, very important now, okay? Because the American diet tends to be very high in sugar. People are exercising less. A lot of people are. So with that comes increased weight and increased fat content. That actually increases the risk of breast cancer development. So that is something that is actually starting to be critically important, that I think people don't understand, that if they actually just do those good health practices, they can decrease their risk of getting a breast cancer by up to 30%. That's not a bad number for something you can do to change it. 30% is a big number. It's not like 5. So I think people need to know that too.
Yeah. I'd also even add in there that avoiding smoking and alcohol in moderation, also 2 big things that we're also knowing more and more information about that are definitely contributing to breast cancer. So just leading a good, healthy lifestyle is definitely one of the biggest things that anyone can do to help reduce their risk of breast cancer.
Well, thank you for the information.
Thank you.
Sure.
Yeah, I appreciate it. Yeah.
Yeah.
And thank you guys.
Thank you.